You know, when I heard this statistic, up to 80% of all women develop some type of fibroid by age 40, mind-blowing. All right, let's look at what a fibroid is. Uterus tissue. What is a uterus? It's a muscle. And so the difference between the fibroid and the uterus is a fibroid is a growth from the uterus. And so it grows out of the uterus. Tissue in a fibroid, it's very non-elastic. There's a lot more collagen in a fibroid. That's why it's hard. But there's some very interesting differences between a fibroid and the uterus. In a fibroid, you have a much greater sensitivity for estrogen, which means that a fibroid is very sensitive to estrogen, okay? It can grow a lot faster with estrogen than the actual uterus. And a fibroid has more receptors for estrogen. There's also more of this enzyme called aromatase going on in a fibroid. Now, what's aromatase? That's an enzyme that converts androgens, which is more for men, to estrogen. The environment in this fibroid has a lot less oxygen than the uterus. That's called a hypoxia environment. We'll come back to that. And lastly, what's unique about a fibroid is that it has a lot more inflammation than the uterus. Now, this is very interesting information because it provides a solution to a very common condition that occurs with up to 80% of all women. But I do not think you can create a dent into this problem unless you take enough vitamin D. Now, there was a study in 2013 in Reproductive Science that showed a significant decrease in the size of fibroids within 12 weeks, taking 25,000 IUs of vitamin D3 once a week. Now, if they took that every day, I think the results would be even better. Here's another study in 2014 on African-American women, and these women had low vitamin D in their blood. They found a high percentage of women with fibroids have a lower vitamin D level than those that had a higher level of vitamin D in their blood. They gave them 50,000 IUs of vitamin D3 every 2 weeks. And then in 10 weeks, they saw a significant decrease in the fibroid size. Here's another study by Cia Vantini. These are women who took vitamin D, and they found the group that took the vitamin D did not experience any fibroid growth versus the other group who didn't take vitamin D had a 40% increase in fibroid growth in vitamin D3. Doctors even discourage women from taking 10,000 or 20,000 or even 50,000 of vitamin D every day because somehow it's toxic. Yet the research shows that you'd have to take hundreds of thousands of vitamin D3 for months to create any toxicity. And really the only toxicity is excess calcium in the blood causing kidney stones. But you can even greatly minimize that side effect by taking magnesium, vitamin K2, drinking a little more water, 2.5 liters of water a day. Those are all the cofactors that will minimize that toxic effect, which personally, I think that if you're taking 50,000 IUs or less, you're not even in that range of having any toxicity. Now, there's a really good book that I'm going to recommend down below on using high doses of vitamin D3. Here's one. I had a large fibroid tumor and the doctors recommended surgery to remove my entire uterus. Well, guess what? After remaining on a high dosage of vitamin D3 with the proper K2, magnesium, zinc, and calcium balance, and of course changing my diet, my last MRI showed that the tumor is now in a necrosis status. What's ironic is my doctor at Emory in Atlanta dropped me because I refused to have the surgery. I really think there's enough data to seriously consider taking more vitamin D as well as the cofactors to potentially do some positive things about shrinking fibroids.